So welcome everyone to the new trainee welcome day for medical microbiology and medical virology. Thank you all very much for joining us this morning. We hope you'll find this morning's webinar useful. So first of all, let me introduce myself. My name is Ronan McMullan. I'm a Clinical Director for Training and Assessment at the Royal College of Pathologists. And my job involves helping the training and assessment teams in the college with the work that they do in overseeing training and assessment to support trainees and trainers across all pathology specialties nationwide. It just so happens that I'm a medical microbiologist, so I'm very familiar with a lot of what we're going to talk about today. And I'd like to begin by welcoming you to the Royal College of Pathologists and welcome you to a pathology specialty. Medical microbiology and virology are two of the pathology specialties that the college looks after, and I'm sure you'll all have a challenging and fulfilling career in pathology, as many of us who have gone before you have. So the purpose of this morning's meeting is to give you an overview of how the college supports your training. But before we start and hear from the various presenters who are coming along to give you that overview, I'd like to deal with a few housekeeping issues. First of all, to let you know that we are recording today's webinar. So that means you'll be able to view it from about a week's time onward if you forget any bits and pieces and would like to recap. It also means that if any of your colleagues were not able to attend today but would have liked to have, they'll be able to view the webinar at their leisure. What I do want to reassure you, though, is that none of your names will be visible on the playback, so no one will be able to see your identity. That said, we would really encourage you to ask questions if you wouldn't mind, because we know that trainees always have some uncertainties and doubts about the kind of material that we're discussing, so please do feel free to ask questions. And the way to ask questions is by typing them into the Q&A box. You can see a Q&A box down the bottom of the screen, so if you type your questions in there, we'll pick them up as we go through this morning's session. There are no mics and no cameras for you as attendees, so the only way to ask questions is by typing in the Q&A box. And also just to ask you to please give us feedback at the end of today's session. You'll see a link to Slido. There's a survey on Slido that a link will appear to in the chat towards the end, and if you'd please click through there, give us some feedback. We'd really appreciate that, and that will help us guide what to do with subsequent welcome days. So just before we begin the presentations, I thought we should have a couple of introductions, because here on the screen you can see some other people have joined me so far, and in particular I'd like to introduce you to the training team. And the training team are Jenny, Louis and Adabi. So I'll maybe ask the three of them to introduce themselves, because these are three very important people for your training. They look after all of the queries that you have. They look after queries that your trainers have about training, and they process the paperwork at the end of your training that allows the college to recommend you to the GMC for the award of CCT. So maybe you would introduce yourselves firstly, Jenny.
Hello everyone, I'm Jenny McGinley. I'm the training manager at the college, and I'll probably end up speaking to each and every one of you at some point during your training. Thank you.
Thanks, Jenny. And Louis.
Morning, everyone. I'm Louis and I'm the training coordinator at the college, and I look forward to working with you.
Thanks, Louis. And Adabi.
Hi, everyone. It's Adabi here. I'm the training coordinator at the college.
Great, thanks very much. And you'll also see on the screen Jo, who is going to speak to you later on. So I'll maybe just let her introduce herself whenever she's doing her presentation. Okay, so our first presentation for you is a welcome from the president of the college, Dr. Bernie Croal. And unfortunately, Bernie's not able to join us in person today, but he's recorded his welcome message for us.
Hi everyone, my name is Bernie Croal and I'm president of the college. I'd like to welcome you today to our new trainee day. Sorry I can't be there live today, so I pre-recorded this message. Pathology is hugely important to healthcare, which I'm sure you all know, with up to 95% of healthcare interactions involving pathology, ranging from blood tests to histology, to the multitude of other services pathology offers. We are 17 very different specialties in pathology, and we welcome everybody from everywhere who's part of our pathology family to be represented by the college, and it's with that I welcome you today. Our 17 specialties cover a diverse range of interests and areas of healthcare, some of which involve direct patient contact, such as with haematology, microbiology, and ChemPath. This may be ward-based activity, outpatient clinics, and even directly with patients using home testing. And in some cases, this may involve the complete management of patient care with overlap to areas such as general medicine. But we are all vital to healthcare nonetheless, and we work together across both the pathology disciplines and also with much wider ranging multidisciplinary teams, MDTs, across primary and secondary care. So something for everyone really. You will of course inevitably be linked to only one of these disciplines as part of your training, but knowledge and collaboration with the whole of pathology is going to be important both as a trainee and as a future consultant. So what are we about? Not just diagnosis, but also screening, prevention, and directing and delivering treatment to patients. There are many opportunities both as a trainee and as a future consultant, such as research. Pathology is vital for most clinical research because we are so pivotal to patient pathways. So not just research looking at new tests, but also using our tests to gauge the success of new treatments, such as drug trials, which are hugely dependent upon the need to monitor the success of any new drug by using pathology testing. Doing research can mean lots of things, of course, and does not necessarily mean going down an academic training route or even a future academic job. I have spent time both in academia and in the NHS, and research is just as important in both. So as trainees, becoming interested, linking up with existing research teams, volunteering your time, developing your own ideas, getting involved, that's the key message here. And there is no quick route. Research activity needs to be built up. Get some ideas, get some data, present at local meetings, develop abstracts, posters to larger meetings, and even oral presentations may come your way. And finally, publishing. But publishing is not the be-all and end-all. Initially, it's usually as a minor offer as part of a team, hence the importance of lining up with established work. Yes, volunteering and doing some graft, some you win, some you lose, but you need to be in the game to get anything out of it. Teaching is another area that holds numerous possibilities, and as trainees, you will begin to deliver important pathology teaching to undergraduates, postgrads, early stage trainees, scientists and allied healthcare professionals, many of whom will form part of your future MDTs. And you will also learn from them. I've learned a huge amount over the years from clinical scientists, biomedical scientists, and other areas outside of PATH, such as dietetics, nursing, and so on. Teaching and research, of course, go together and will continue to be part of your future careers, whatever you do. And of course, they will form the basis of those of you who do choose pure academic careers. Within each specialty, there are, of course, options for specialising in specific areas. This needs some thought, as it may be linked to both your interests or indeed an essential requirement for a future job you may want in a particular place. Every pathologist is different, every job is different. Looking back, I specialise mainly in intravenous nutritional support, cardiovascular risk, and bariatric surgery services. Research-wise, demand optimization, large randomized control trial support, and new biomarker innovation were some of the areas that I focused on. Some of this, of course, happened by accident, but some of it was also my choice. There's no rush to finish training and move to that CCT point in as short as possible time. You may find yourself at the top of the training escalator very quickly, but you may not be competitive enough to compete for that job that you want. Take your time, expand your portfolio and CV so that when you reach the end of training, you can get to the jobs that take most of your interest. Job opportunities are much wider than the past, and there's a lot to think about. It's not just about NHS careers. There's academia, there's industry, private sector, jobs abroad, and even other sectors. I'm a biochemist, good with numbers arguably. And even areas like hedge funds are after people like me. Well, not at my stage, but certainly trainees coming out. But don't forget, while you work hard and you get paid for that, you are inevitably costing UK taxpayers to train you. So at least personally, I have always felt an obligation to remain within the NHS as much as possible. And that is more important now than ever before, given the challenges this country faces. So don't forget that, although inevitably it's your own choice. Work-life balance within pathology is good, and it may be a reason why you chose it. Flexible working is now easier to do both as a trainee and a consultant. Working from home or indeed anywhere is now possible with online MDTs and reporting and digital pathology opening up many new doors. It does not mean we work less, it just means we work differently and have more options. So while personally I have not had to spend, for example, a single night working in hospital because of my job, I have chosen at times to work long hours and volunteer my own time because I want to, either to benefit me, my department, or patient care. But most importantly, choosing to do it rather than having to do it is what makes all the difference, in my opinion. The college is a relatively young college, forming in 1962. It's here to support all other pathology specialties. This means that whatever specialty you are in, the college is there to support you, to help you, and to lobby for you to have the support and resources you need to be able to provide the healthcare outputs to patients that they need. We facilitate rather than directly deliver training, of course. That's mostly done locally. However, we do write the curricula, deliver examinations, host training portfolios, and sign off the CCT at the end. We also provide many useful learning opportunities, such as the Developing Pathology Portal, an award-winning platform to assist learning and examination preparation. Also, there's a multitude of webinars, tutorials, and symposia that will come your way. We have a trainees committee. Please try and get involved, and many other activities associated with public engagement, media, and learning. So there's lots to do. Let me finish though with some harsh truth, some elephants in the room. We all work in medicine at a very difficult time just now. Under-resourced, understaffed, waiting list pressures, financial pressures, and in some cases failing services. There are no short-term fixes. This may at times, of course, impact training and make the day job harder. I urge you to try your best to be more sympathetic and more of a team player, supporting each other, wider colleagues, and of course your trainers when times are tough. Secondly, another hot topic is exams and exam cost. Exams are expensive. I know this. As a college, we deliver multiple stage exams for the 17 disciplines and other groups. We only have a small but dedicated team backed up by hundreds of volunteer examiners. Yes, volunteers, we don't pay them. We do not also make any profit out of exams. The cost of exams is what it costs to deliver them. So we keep the cost as low as possible, but despite this, we recognise the difficulty, especially in today's climate. And so make sure you take advantage of things like tax rebates that are available on exam fees to help reduce this burden a bit. Your journey with this college begins now and will hopefully span your entire career, supporting you in CPD, education, guidelines, standards, and of course, representing the profession to government, the media, and the public. Colleges are going to be a vital part of your future careers, for your future professional well-being and the standing of our disciplines. But remember, colleges are not a them and us situation. We are all largely volunteers, including me. You are part of this college now. This is not my college, or indeed your college, it's our college. I wish you all the best in your future careers, and especially the training period you're now entering. You will not regret your choice. Thank you.
Okay, so thanks very much to Bernie for that. Hopefully that's given you an overview of what the college does and how the college might help support your training in the coming years, and what some of the career options are for you as you think ahead to the future. So our next speaker is Joe Brinklow, who is the Director of Learning at the college. Basically, Joe is the boss of everything to do with training and assessment and exams, and there's nothing she doesn't know about those topics. So Joe today is going to give you an overview of the role of the college broadly, but more specifically the role of the college in training and assessment and exams. So hopefully Joe's session will answer quite a lot of the questions you have in your mind. But do feel free to type some Q&As in the chat as we go along this morning, because we'd like to hear from you. Over to you, Joe. Thank you.
Thanks, Ronan. Can I just check as well that at the end I'm just going to cover a little bit about the Trainee Advisory Committee? Is that okay?
Great, thank you.
Yeah, cool. Okay. All right. So good morning, everybody. Really nice to see you, albeit virtually. As Ronan said, I'm Director of Learning at the college and have oversight of all of the things that he mentioned, and also the college's international activities as well. And I'll just touch on that briefly in the presentation that I'm just about to do. Let me just sort out the proper. That's it. Okay. All right. So, as we've said, and you'll hear this lots of times from all the various speakers that are coming on to speak to you, welcome to your college. I'm just going to outline some of the things that we do with regard to training, exams and assessment, but I'm going to also touch on some of the wider things that we do as a college, very similar to what lots of other colleges do as well, but just to give you a bit of a wider perspective. But firstly, just in terms of your initial journey with the college, the things that you will probably come up against most quickly. The college has a range of specialty advisory committees. Now, because many of you will also be in touch with the Royal College of Physicians as well, because we have lots of dual trainees in the infection specialties. It does get a little bit confusing. So our SACs are broad specialty committees. They oversee everything to do with their specialty, apart from training. And then we have the training committees at the college, which are the CSTCs, College Specialty Training Committees, who focus specifically on training, and they report into the SAC. But I'm aware that at the Royal College of Physicians, the JRCPTB, their SACs are specific to training. But we all know what we're doing, don't worry. And we make sure that we coordinate. For the infection specialties, the arrangement that we have is that there is a CSTC for medical microbiology and virology. That's a joint CSTC, same as the RSAC actually. That's microbiology and virology as well. And then the Royal College of Physicians, under the auspices of the JRCPTB, they have SACs for infectious diseases and tropical medicine. But then we also have a joint committee, which is the joint committee for infection training that looks at all of the issues pertaining to training, exams, assessment, e-portfolio, across the whole spectrum of the infection training specialties. And we coordinate meetings so that all of those meetings happen together in quick succession to make sure that everybody's up to speed and that there's appropriate representation on the various committees that we have to oversee training. I've mentioned the TAC as well. Unfortunately, the chair of the TAC can't be with us this morning, so I'm just going to touch briefly on our Trainee Advisory Committee and what they do at the end. So all colleges develop curricular and assessment systems and deliver examinations. And again, because of the dual nature of infection training, I will touch a little bit on how that works for you across both colleges, because it can be confusing. But once you've sorted it out, you'll get there and you'll know what to do. E-portfolio. So for infection training, the JRC-PTB deliver the infection portfolio for all of you. So there's no split portfolio. You go to the Royal College of Physicians. You've probably already got the portfolio anyway because of internal medicine training, and you carry on using that portfolio. We produce ARCP guidance, so that's just a really helpful summary as you're coming to the end of each year of training for your review. That gives you a really helpful summary of what you should be aiming to do. So keep an eye on that throughout the year just to make sure that you're on track, and obviously your e-portfolio will help you track that as well. You're going to hear about the pathology portal later, and Bernie's already mentioned it as well, but that will be a really helpful resource to you as you go through training, and something that you can contribute to as well. We have lots of trainees that contribute content to the pathology portal, and it's all welcomed. If you need any advice and guidance through training, you can get that from your deanery, but sometimes it might be that you'll need to come to either us or the JRC-PTB for advice, and we're very happy to do that. There will be contact details at the end of this presentation so you know who to contact. And then in what will probably feel at the moment like a long way away, but I can assure you will go very, very quickly, when you come to the end of your training, between us and the JRC-PTB, we'll be recommending you for your certificate of completion of training to allow you entry to the specialist register. And that's why all of the things that we give you to evidence your progress in training, all of the advice that we provide throughout means that once you get to that stage, it should be a really straightforward process, and you'll be on the specialist register before you know it. There are also regional structures within the college. So our college has one office based in London, but we have obviously members all throughout the UK, and actually about 25% of our members are based outside of the UK as well. So we are international, but we have regional structures within the UK to allow our members to ask questions, raise concerns, come up with ideas, and have those fed back through our structures to make sure that there is a voice for everybody throughout the UK. Obviously, with training, we have training programmes across the UK too. Our training committees that I mentioned have complete regional representation through training programme directors, and there will also normally be external input to ARCPs as well, again managed through neighbouring regions and deaneries. Just to touch a little bit on international, so some of you may know, you may have come through this route, that the college provides support for international medical graduates to obtain GMC registration in order to come to the UK and train. There is still quite a bit of demand for that. We're very happy to help all of those trainees coming in through that route who meet our criteria. Just also to mention that the college does quite a lot of work with other institutions internationally, and also through funded projects. And one of the biggest demands that we have is for content to support learning. So there are quite a lot of webinar resources that are available on the website, also up on the pathology portal as well, that you should probably find helpful and you can make use of, because everything that we produce for our international projects is also available to all of our trainees and all of our members. So, for example, we did a project with the Ghana College of Physicians and Surgeons over the last couple of years. They were rolling out new pathology curricula, including microbiology, and asked us to provide content to support some aspects of those curricula. So you will find on our website a range of webinars around certain medical microbiology issues that you're free to look at any time. Just to touch briefly, I've sort of mentioned this in passing, but the arrangement for infection training is that most trainees are training in a dual specialty. So we do have some trainees that are single specialty microbiology or single specialty virology, but for the vast majority of trainees, they're training in some form of dual combination of the various infection specialties that we have. So I thought it might be helpful just to sort of outline how you make sure that you're registered and we know about you, and that the JRCPTB knows about you, so that you have access to all of the information that you need and all of the tools that you need through training. So if you are a dual trainee in microbiology or virology with infectious diseases, then please register with the JRCPTB. They, as I've said, they will make sure you have access to the e-portfolio and all of those kinds of things. If you're single specialty microbiology or virology, then please register with us at the college. We will point you in the direction of the e-portfolio. The JRCPTB will know about you. You should have no, excuse me, no problems accessing the e-portfolio. But just to be really clear, where we have dual trainees, both our college and the JRCPTB are responsible for your training. So we essentially monitor the microbiology or virology side of things, and they essentially monitor infectious diseases, tropical medicine, that type of thing. So if you're a dual trainee, please let us know. There is a section on the college website, you'll see here, where you can click on this little button and you can just fill in a little website form. There's no payment to be made because you've already paid the Royal College of Physicians, but it just lets us know that you're a dual trainee, and we can make sure that you have access to everything from our side as well. And I'll talk a little bit about what else that includes other than the training and assessment side of things. As I've said, every trainee, regardless of single specialty or whichever dual combination of training they're doing, has to use the JRCPTB e-portfolio. And all trainees must attempt the exams that are run by our college, by the RCPath. Again, just to be clear, if you are a trainee that is doing microbiology or virology, either as a single or a dual specialty, then when you're applying for your first exam, apply for it as the FRCPath Part 1. If you are a dual trainee not doing microbiology or virology, then you apply for the CICE, which is for trainees who are not going on to do microbiology and virology and therefore not required to do the FRCPath Part 2. So again, that I'm sure will be covered in the exams talk later, but really just trying to make all the pathways and avenues clear, because as I say, can be quite a lot to get to grips with at the start of training. Also, just to mention, when you do register with us as a trainee, one of the things that we offer that you can buy is the Totem Pro card, which is really a really helpful card. You might have seen it when you were at university. If you're very old like me, it used to be called the NUS card, but it's a card that gives you access to a huge range of discounts in online shops, high street stores, with train travel, holidays, all sorts of things. So have a look at that once you get the information from us. And if you want to purchase one, you can purchase one through us. You can buy them for up to 3 years for, I think it's about £25. As I mentioned to some of the other trainees we welcomed last week, sometimes waiting for Black Friday offer in November is really good because you get a really, really cheap deal as well. So just take some time to have a look at that when you get a moment. So what else do the college do? As I said, when you sort of first join the college, you'll be focusing on everything to do with getting you up and running in training and then progressing through training. But actually the college does a huge amount more. I'm talking about what our college does, but this equally applies to the physicians and all of the other medical royal colleges. So we provide support for undergraduates and foundation doctors that are interested in a career in pathology. Again, some of you may have come across this already. We have essay prizes, we have foundation fellows who are undertaking periods of pathology training in their foundation training, and we provide them with information and support through that. We have a undergraduate pathology curriculum to promote pathology in undergraduate as an undergraduate. So all sorts of things really to raise awareness of pathology and encourage doctors to think about it as a career. One of the increasingly important things that we do is undertake workforce surveys to allow us to gather evidence about pathology and then use that evidence to lobby government to advocate for pathology services across the UK. For example, making the case for increased funding for training posts, consultant posts, for laboratory provision, all sorts of things. And that really is one of the key focuses of the college over the next few years. As you complete training and move into your next stage of your career, perhaps as a consultant, then you can use the college's CPD portfolio and the revalidation support that we provide. And we also do lots of other things. I won't go through it line by line, but you can use access our guidelines. You can access our conferences and webinars. Many of our conferences and things now are online, and many of them are recorded, like this one is going to be, and you can go back and watch it at a later stage as well. We also do some public engagement as well, again, just to increase understanding of pathology for members of the public so that they know and understand better about the role of pathology and the role it plays in healthcare. And these are just some examples of some of the things we've done most recently. So prior to the general election, we released our election priorities. And actually, the doctor you can see on the front of this is Natasha Ratnaraja, who's the chair of the Microbiology and Virology SAC, just by chance. But also you can see then this is just a screenshot on the right-hand side that's taken from the homepage of the college website that just gives you a broad overview of some of the activities that we take part in. So, for example, the new government wanted evidence about the NHS following the announcement of the Lord Darcy review, and we put that together at very short notice and submitted that, and you can have a read about what we said there, but lots of other things to have a look at. And then these are our training pages. We're just about to undertake a website review, so it might not always look like this, but trainee information will always be very evident from the homepage of the college website because it's so important to what the college does. So if you go into the training section, you'll be able to find your curriculum and all of the information. Similarly, you will be able to find it on the JRCPTB website as well. So we all hold the same information on our websites. Just a little bit as well about some of the other organisations that we work with. And again, this also equally applies to other colleges too. So in terms of postgraduate training, assessment and examinations, all of us are regulated by the General Medical Council. We can't make any changes to our curricula, our assessment systems, our examinations, unless the GMC have reviewed those changes and ensured that they meet their standards. We also obviously work closely with the postgraduate deaneries, so they will be, again, another contact for you. Obviously, the deaneries deliver the curricula that the college has set out, and the GMC also oversee that delivery too. And then there are the local education providers where you actually undertake your training. And the college sort of has communications and relationships with all of those groups. So these are the standards that the college has to meet. The first two, Excellence by Design and the Generic Professional Capabilities Framework. So Excellence by Design is I think the second version of the GMC standards, and all of our curricula at the Royal College of Pathologists were updated and approved in 2021 in line with those standards. And those standards for the first time incorporated generic professional capabilities. Again, you will see those throughout your curricula if you have a look through. And then the Promoting Excellence document applies to deaneries and is about the standards that the GMC apply to them in the delivery of the curricula that the college has set out. Just also a reminder, you may have seen this already, you may have completed it already, but the National Trainee Survey is really important. The GMC do this every year, asking trainees for their feedback, and then the GMC will provide a big report at the end of that, and deaneries and colleges are able to look at that feedback by area, by specialty sometime, and it just gives us all a useful insight into how trainees feel about their training. So when that comes around, please remember just to spend a few minutes completing that. And then just to be clear about the role of the deaneries, again, I think when you're starting as a trainee, there's so many different organisations that are there sort of overseeing your training, delivering your training. It can be sometimes a bit tricky to understand exactly who does what. But the deaneries are delivered through the Four Nations. So you've obviously got NHS England, NES, NHS Education for Scotland, the Wales Deanery and the Northern Ireland Medical and Dental Training Agency. And the deaneries are responsible essentially for programme management, and really key to this is delivering the annual review of competence progression, the ARCPs. So you will have to undertake those towards the end of every year of training, and then the colleges collect the data from that, the outcome data, and we just keep a view on that and keep an eye on everything that's going on just to make sure everything's progressing. If you're ever confused and don't know who to go to, don't know who to ask, I always advise all trainees to contact us at the college or contact the JRCPTB. Even if we're not the right organisation, more than likely we'll be able to point you in the right direction of who you need to ask for anything. So please don't worry. If you've got a question about your training at any point, not just at the beginning, at any point through your training, contact the college, and if it's not us that can help, then we'll make sure that you're pointed in the right direction. And then these are the various teams, both within our college and at the JRCPTB, that can help you as you navigate your way through training. So for training, you can either contact us at the college, particularly if it's around Microbiology issues, or you can contact the JRCPTB. I think that they have like a email that you can send through their website rather than an actual specific email address. So if you click on the contact us link at the website, you'll be able to put your query in there and then someone will get back to you. And same for ePortfolio, their ePortfolio queries work in the same way. If you want to know more about the pathology portal or want to get involved, then you can contact the team on pathology portal at RCPath, for your examinations, exams at rcpath.org. I think, as I mentioned at the start, unfortunately, Sophie, who's the chair of our TAC, can't be with us today. Again, just by chance, Sophie is a dual trainee in infection. So It's a real shame that she couldn't be here to meet you, but her talk will be made available afterwards. But I just wanted to flag a few key things about the college's Trainee Advisory Committee, how it works, and just so that you've got some information to start thinking about, and you can go and have a look on our website as well. So the college is responsible for 17 pathology specialties across a whole range of both medical, clinical science, dental and veterinary pathology specialties. So we're a very broad church, and trainees from each of those specialties have the opportunity to be represented on the TAC. The TAC currently meet twice a year, I think sort of roughly May and November. And about 6 weeks or so before each meeting, we contact all the trainees that we know about, and the TAC reps also use their networks as well to go out, and we ask trainees for their feedback, if they have any questions, anything at all that springs to mind, and then all of those questions get sent back to me to answer, because normally they're all about training or examinations or something like that. So I coordinate the answers for all of those questions. They are discussed at the TAC and then fed back to the trainees that ask them. It's all done anonymously, so the administrator that looks after the committee will know who you are, but when we get the questions, we don't know who's asked them. At the TAC, there is normally always representation as well from the college president and often the vice president for learning, who is currently Professor Marta Cohen, who works with us on our team, just to discuss issues of the day, issues of concern to trainees. And also I go along with Ronan and also with Professor Nikki Cohen, who is our Director of examinations, again just to discuss any issues, and the trainees at that point will have spent the morning going through the various agenda items themselves as well. Training reps are also on all of our SACs, our training committees, and as I've said, can get involved in nearly every activity of the college from a very early stage, including things like the pathology portal. So we'll notify you when Sophie's talk goes live. If you have a look on the college website under the committee section, you can have a look at the TAC page. Once you're registered with the college, you'll be able to access the minutes and things to have a look through those as well. So well worth having a look at if you'd like to get involved with the college as a trainee and represent your colleagues. So I think that is everything from me.
Thanks very much indeed, Jo, for that very comprehensive overview of what the college does and how the college supports training in particular. So thank you. As you said, unfortunately, Sophie has not been able to join us this morning, but she is going to record the presentation that she would have given, and that will be uploaded as part of this webinar whenever the webinar is uploaded to the college website. So you'll be able to hear from Sophie in about a week or so. And I would, just reiterate what Jo said and what Sophie will say about getting involved with the college. We'd really encourage you to get involved with your training as much as you can. Get involved with the college either through the Trainee Advisory Committee or some of the other training activities that go on either within your deanery or more directly at the college. And one of the ways you can get involved with the college is through the Pathology portal, by contributing to the Pathology portal. And so our next speaker is Dr. Esther Hughes, who's the Clinical Director for Digital Pathology Education, and Esther oversees the running of the Pathology portal. So we're delighted to have Esther here with us today to give us a summary of the Pathology portal, and perhaps also to try to persuade you that you can contribute to that and make a really meaningful contribution to the material that trainees and pathologists more widely benefit from. So I'll hand over to you now, Esther. Thanks very much.
Thanks very much, Ronan, and hello everybody. My name's Esther Hughes. I'm a histopathologist. I'm currently working at the University of Glasgow as a full-time autopsy pathologist. So I know nothing about your specialty, but I am here to tell you about the pathology portal. As Ronan said, I'm the the clinical director for digital pathology education at the college, which basically means that I oversee the pathology portal. So this is the pathology portal, or at least this is what it looks like when you log into it. So the pathology portal is an online educational platform that's been designed and developed by the Royal College of Pathologists in collaboration with NHS England and with their technology enhanced learning team. It's initially aimed at trainees in pathology to provide another source of educational resource for your specialty. And so all of the pathology disciplines are covered by the pathology portal, and it's available to any, well, not just pathology trainees, actually it's available to anybody who works in pathology or has a particular interest in pathology. And it's really easy to access online, and because it's available online, it provides educational resources that are therefore available to anybody, regardless of where you're training. So it kind of smooths out some of those variations in accessibility to training resources. So in order to access it, you need to go to the Learning Hub. So the Learning Hub is an online platform that hosts the pathology portal, and you can sign up to the Learning Hub. If you have never signed up to the Learning Hub before, you just need to have an NHS or an academic email, and it's really easy to sign up to it. If you already have an e-learning for health login, then that will work, or you can also use Open Athens as well. So fairly simple to sign up to the Learning Hub. When you sign up to the Learning Hub, you then need to find the pathology portal. So on the main page, when you scroll down, you get to catalogues, and one of those is the pathology portal. It's usually up at the top because it's one of the most accessed catalogues on the Learning Hub. And you'll see on this screenshot, I've got access granted here. Now, when you first access the pathology portal, you won't have access granted because it is a restricted catalogue, restricted to those that have a genuine interest in pathology. The reason we restrict it is because some of the materials on there are probably not suitable for a general lay public access, but they are designed for you, for trainees in pathology. And basically, when you click through to the pathology portal and try to click on any of the resources, it will say that this is restricted, and it'll give you the opportunity to apply for access. That's really granted very, very quickly. So during the working day, your access request will be granted probably almost instantly, within a few minutes. If you're out of hours, it might take a little bit longer, but it will always be responded to within less than 24 hours anyway. So it's very, very quick. And once you have that access granted, you can access anything in the pathology portal. You don't have to ask for access to individual resources. It will just give you access to anything in the pathology portal. And that includes your own specialty, but also all the other specialties as well. So if you're curious to look at what is in there under other specialties, then you can have a good look around. So once you're in, this is what it looks like, or at least this is the top of the screenshot because I can't fit everything in. So you get through to this spine of all different pathology specialties, and it's listed in alphabetical order apart from undergraduate starting at the top. So infection is the one that you would be looking for. But like I said, you can have a look at the other specialties if you like as well. And sometimes there are useful resources that are in other specialties that you can that might be interesting to you as well. So if you click through on infection, these are the kind of subcategories that you get, and you just click through on each of these folders and you'll find lots of different subfolders and subcategories and things. So just kind of click through and have a good look at what's there. So for example, if you click through on podcast, you come across this list of parasitic disease lectures, and there's a whole host of these very excellent lectures that have been added into there. Another example is a sort of case-based thing. This is one called Pruritus Ani in a child, and it takes you through with a bit of clinical information, then asks you some questions, which it asks you to answer. So this is about Pruritus Ani, so it's about enterobius vermicularis infection. You click through, submit that answer, and then it takes you through to more questions and more information about this particular infection. So we've got an example of what a sellotape test looks like, and then also a biopsy, so a histology image of the vermicularis, the enterobius vermicularis in the colon. So just an example of a sort of case-based type resource that is on there. Another example under infection are some 1-minute micro videos that have been put together by the University of Swansea, and they're really excellent as well. The other thing that I would just highlight to you, which is really helpful, is the search function in the catalogue. So when you're on the main catalogue page, what will come up normally is that spine of all of the different specialties. But there's another tab that you can click called Search Catalogue, and you can enter your search criteria in there, and it will come up with all of the different resources that are on the portal that are linked to that particular search inquiry. So that's a really, really useful thing. For example, in histopathology, we have a lot of cases that are put up without giving the game away about what a diagnosis is. So it will just be listed as case 1, case 2, case 3, and it will take you through and sort of test your diagnostic skill. But if you wanted to look for a particular diagnosis, then you could search for that diagnosis in the search function and just bring up all of those resources related to that. The other thing to say is that you can actually log on directly from your Royal College of Pathologists account on the RCPath website. So there is a function to be able to link your login from the Royal College of Pathologists to your login on the Learning Hub, and it means that you just have to sign in once rather than having to sign in multiple times on multiple platforms. When you access the college website, on the drop-down list under your account, there will be a tab for accessing the pathology portal, and then it takes you through those steps to be able to link your college login with your Learning Hub login, just to make things simple. So I'd like to end on a plea, because we actually really need you. So infection is one of the areas of the portal that's still very much under development. In fact, all of the areas of the pathology portal are still under development. We have learning resources being added all the time, and we have a team of editors who create resources and add content. The actual technology of the Learning Hub platform is also under development as well. So sometimes things don't always work perfectly, but we like to get feedback, and we like to tweak things and change things to make a better user experience. So we do want to hear from you. In infection, we particularly do want to grow the content that's there, because at the moment there's some excellent stuff, but we also want to be able to create things that are useful to you and your training. And so partly we need to hear from you about what that is and what would be best, that you think would be best to be created on the portal. So please let us know your suggestions for content. You can also create content yourself, and you can send teaching materials to us, to the portal team, to the microbiology editors, and we can add those to the portal on your behalf, and obviously credit you if that's something that you've created yourself. For example, if you give a talk to undergraduates about infection, or if you give a talk for your local training event or something and record it, then that's a really excellent way of sharing teaching across the whole of the UK, essentially. You can also join the editorial team. So if you have a particular interest in teaching and creating learning resources, then we have an editorial team which is formed of both consultants and trainees in all the different pathology specialties. And those people have particular special access to the Learning Hub, to the pathology portal, and can actually create the content. So it's a slightly different access. And so we're always looking for new people to join our editorial team and to create new content. And in Infection, we are actually just about to email out to all of the college people that are registered under Microbiology and Virology and Infection, to ask for new people to come and join our editorial team and to contribute content. So if you want to get in touch, then you can do so by contacting the Pathology Portal email that's there. You can contact me directly. That's my email there as well. And I'll happily put you in touch with the other microbiology editors that are already on the team, and so that you can contribute. And we also really welcome feedback about the content as well. On the Pathology Portal, there's an ability to rate a resource, a star rating 1 to 5. We hope that lots of people get 5-star ratings, and in fact, a lot of the content does already have a 5-star rating. But actually, there was a technological change that happened to the Learning Hub about a year ago, which meant that function doesn't work all that well at the moment. You have to refresh the page before you can rate a resource. So that's one way that you can give us some feedback, but we actually like to hear from you directly as well. So if you ever want to give some feedback about content, it might be that you've accessed something and you realise that there's an error or a typo or something like that, or something doesn't work very well, or you might want to just get in touch to say how useful you found something and that you want to see more of that particular content or something slightly different. So we really welcome that type of feedback. And the easiest way to do that is to email the Pathology Portal team at the college address that's given there. So hope that you enjoy the content that's there, that you get some benefit from using the content that's already on the portal, and we'd love for you to get in touch to help create new content as well. So that's it for me. Thank you very much.
Thanks very much, Esther, for that really great overview of the portal. And, if I could just reiterate the get in touch and get involved message, because I think for new trainees, it's really easy to think that that people contributing to the portal are, very experienced and old pathologists, but actually new trainees have a really unique perspective on what's useful when you're trying to learn pathology specialties such as microbiology and virology. So, what I'd say to all of you is, if you have a learning encounter of any type, a lab scenario, a clinical scenario that you think has been useful, then, talk to your colleagues or consultant colleagues about how to develop that into a little piece of learning material, and get in touch with the portal about contributing that. So, please do be tempted. And the other thing to keep in mind is that, one of your curriculum outcomes is about being able to demonstrate that you can act as a clinical teacher, and developing learning material for the portal would give you some evidence to put in your portfolio to evidence that you're doing just that. So you could benefit from it as well. Thanks again, Esther. Okay, so our next presentation is a joint presentation from 2 colleagues, Dr. Harriet Hughes and Dr. Anne Tunbridge. Harriet is the chair of the Medical Microbiology and Virology Specialty Training Committee at the college, and Anne is the chair of the Infectious Diseases Specialty Advisory Committee at JRCPTB. And both of them, infection's very complicated, as you'll know by now, and so both of them co-chair the Combined Infection Training Specialty Advisory Committee that looks after your training in the first 2 years of whichever infection specialty you're in. So I'm going to hand over to Harriet and Anne to give you an overview of the infection curriculum and training pathway.
Oh, thanks, Ronan. Thanks very much for introducing us. Welcome, everybody, and it's nice to virtually meet some of you, hopefully meet some of you in person as time goes on. Ronan's introduced Anne and myself from a college perspective, but in my day-to-day job, I'm an ID micro consultant in Cardiff. Lots of different clinical interests, but also, as you may have guessed, so medical education and training is also an interest. And I'm the TPD for microbiology in Wales, and it's in that capacity that I am the co-chair of CIT and the RCPath chair for the training committee. Today, I think Anne and I are going to go through different aspects of your training, some of the background to training and what you need to do as you progress through, as well as going through out of program activities and research. Please do, if you have questions along the way, jot them down, and we'd be very happy to answer any questions at the end around what we're talking about or about kind of related things that we may not have covered. So organisation and delivery of training, as you may have already realised through your career progression to date, has lots of different people involved, lots of different cogs in the wheel. So obviously with your local training programme for infection, there's your local TPD or TPDs and heads of school, and you will also have a regional specialty training committee that oversees that particular training programme. Alongside and closely involved are what we used to call the deaneries, and now there are multiple different acronyms for the 4 nations, which I've listed there and won't go through, but all extremely important part of delivery of training and overseeing and quality assurance of training programs in general. And then at a national level, we have our specialist advisory committees. So those are the committees that we've just explained that Anne and myself are chairs of. And Anne's got a nice slide at the end just to kind of go through how some of these how the decisions are made through the different groups of people. In terms of the background to infection training, there have been a lot of changes over the last 10 to 15 years, and that is really in response to workforce demands, both from a clinical perspective and a laboratory perspective. And there's been lots of changes, and I won't go through those in details, but one of the biggest changes was a decade ago when MRCP was required for entry into any infection training programme. And at that point, a lot of mono-specialty training posts became dual specialty training posts. And then in 2021, which you'll be very familiar with, there was a big change to training programmes, all training programs in response to the shape of training review. And the main thing for us is that we have entry after IMT3 for ID and internal medicine, and entry after IMT2 at least for the ID micro, ID virology, or single specialty training programs. There are changes to the curricula and the assessments as well, and they will be the curricula that you'll be following, and I'll kind of go through those shortly. So you'll be quite familiar with this slide. So combined infection training, whichever pathway you're on, is for 2 years. On the left, we've got the mono-specialty micro and virology. So entry after IMT2, 2 years of combined infection training, and then 2 years of your higher training. And then on the right, you've got the same process, but 3 years of higher infection training. And then I know we're in a RCPath New Trainees Day, but for ID internal medicine trainees, they have their 3 years of IMT and then 2 years CIT, as for you guys, and then 2 years of higher training. It's worth just mentioning briefly tropical medicine, because this may be something you're less familiar with. But applications for tropical medicine are from pre-existing NTN holders like yourselves. And the training is as for ID, and it can link with IM medical microbiology, medical virology. But as part of that tropical medicine training, you do 1 year of your HIT at UK Tropical Centre, which is London, HTD or Liverpool, as well as 1 extra year in a resource poor tropical medicine setting approved by the SAC, and you also complete your full-time DTM&H. And those posts are advertised when they're available, but we can answer further questions if required, but I thought it'd be worth just including that there as the application process has changed recently. With respect to the content of learning of training programmes, we recognise that there are regional differences in training programmes. So, and that really depends on how infection services are organised in the area that you work. But in general, the experiences are very wide and varied, and overall, the curriculum outcomes can be achieved by a number of different ways. And so your experiential learning will be from a number of different areas, depending on what post you're in. So it may be an on-site laboratory, it may be an off-site laboratory, and you get used to working with both those environments. You'll be working microbiology or virology hubs and specialist MDTs on specialist ward rounds, reviewing patients on the ward, and also doing outpatient clinics of a huge different variety, and those will vary between different centres. And of course, your inpatient care, if you're doing during CIT for the infectious diseases component of your training. And again, the way that's structured will probably be different between different centres, but overall, over the 4 or 5 years, your experiences will be similar and you'll be following the same curricula. Within your training programs, you'll have regional training, you'll have training days, but it's worth remembering that there are kind of national training days and opportunities as well through all sorts of different routes, but particularly specialist societies or college or other training courses and meetings. And through the SACs last year, we put together a list of courses and conferences that we thought you might find helpful. And that list has been circulated through TPDs, and it will also be available on the JRC PTB SharePoint site, but we can talk about that at the end if we need to. But hopefully that's a useful piece of information for you. It's not an exhaustive list, but it is hopefully a useful resource. Trainees use a huge amount of educational resources from podcasts, webinars, as well as more kind of traditional resources. And it's definitely worth talking with your peers and networking with trainees from other centres as well to find out what you can use. We've just heard all about the pathology portal. But there's also other things such as Learn Infection as well through the BIA website, which again is another source of different infection questions. And there are various other things that you'll find useful. You also can have additional experiences through your training from OOPS, and Anne is going to talk about that in more detail towards the end of our talk. So I really wanted to just highlight the variety of different training opportunities there are, and the variety and how they do vary, but hopefully you can also kind of share information between yourselves to find those different resources and what's useful for you. So just talking about how you move through training, you'll all be familiar with educational supervisors, and hopefully you've been assigned an education supervisor for your new training programme, probably for microbiology and or virology and infectious diseases, and sometimes you have one, and sometimes you have a different one for the different specialties. But again, that's down to kind of local arrangements. It's worth making yourself familiar with the individual curricula and how they're assessed, really, so that you know what you're heading for the ARCP at the end of the year. So have a check out the portfolio, check out the curricula, and I'm going to talk through some of those in more detail now. The ARCP process is as you will have experienced to date, but it's essentially an annual review of your portfolio and how you're getting on, and or if your training is not aligned with the annual review, there may be other panels at different points in the year. You are following the ARCP decision aid for the 2021 curricula, and there's a curriculum for infectious diseases, and one for microbiology, and one for virology. Workplace-based assessments, again, you'll be familiar with some of these from your previous training, but we do, and I'm not going to go through them all in detail, but CBDs, ECEs, mini-KEXs, ACATs, and then, of course, DOPS, MSFs, and then other more specialised ones, such as the QI project assessment tool. On the right, I've just put a snapshot of one section of a decision aid, so it's about 4 pages long, so I've only put up 2 of those pages. This one is for ID and micro or virology, so a dual training. So essentially down the left-hand side, it's what's required. So every year you can see along the top that you need an ESR report, ES report, so you need to have your regular meetings with your ES. I thought I'd just show at the bottom here, this is the indicative minimum number of workplace-based assessments. So in CIT year 1 and 2, you need 6 per year. As you can see here, using each tool at least once. And then the DOPS are spread over the whole of CIT, recognising that trainees will do blocks of, for instance, microbiology or virology separate to the ID. So it's spread across the 2 years to enable you to have flexibility in when you're doing those during that time. So have a look at the curricula for the full decision aids, and just to point out that they are different. They're very slightly different for CIT, for mono-specialty and dual specialty, and then they're a little bit different for the HIT training too. And then for your ARCPs, the way that the competencies are assessed is rating yourself and your ES using the evidence in your portfolio to rate you against the capabilities in practice. And this is these are new since the 2021 curricula, and for all doctors in all specialties, there are 6 generic SIPs, which I've listed here on the right, and they're described in the GMC Generic Professionals Capabilities Framework. And for those, you are rated as below, meets or above expectations, and you rate yourself, and you rate your ES rates you based on the evidence, and over your training, you will kind of progress to be meeting or above expectations for all of those to achieve your CCT. But for our specialty, we have 7 specialty SIPs. There is actually an 8th if you're also training in tropical medicine. And these are specific to us specialists in infection, and they relate to both the laboratory side and the clinical ward-based tasks or activities. And these are rated differently. So they're rated using levels of entrustment, they're called. And these are levels 1 to 4, with level 1 being that you can only observe. So entrustment level 1 is only observe that particular activity, and level 2 is that you can undertake the activity with direct supervision. Level 3 is with indirect supervision, and level 4 means you're independent of supervision, so you can just carry out that task. And I just wanted to highlight that there is much more deep. These are obviously very broad brush, higher level curriculum activities, but if you hover over them, there is in the e-portfolio and in the curricula, there's much more information under the descriptors, and so that gives you much more information about what that actually means. What actually do we want you to be able to do regarding infection prevention and control, and then you get much more information if you look at the detail. And I think that's useful to know because it's not immediately obvious when you open up your e-portfolio. This table shows you the different levels that are required depending on where you are in your training. So as you can see here, you start off by the end of level CIT year 1, you're still the expected level is that you still need direct supervision for all of these, and some of you will be at higher level than that because you've had previous experience, and so you don't have, so this is the minimum requirement, and you can see by the end of your higher training, so year 4 of your whole training, you are independent in all of the level number 1 to 5. And then 6 and 7 specialty SIPs relate more to the inpatient care. So if you're a monospecialty trainee, you're not expected to reach that independent level for the inpatient care. But if you are a dual trainee in ID and micro, then obviously that's you are required to reach the independent level for the direct patient care. The other issue to point out about the curricula is there is a lot of detail in the syllabus, and I've just given you a little snapshot for CIT, but there's also a syllabus for micro, a syllabus for virology, and a syllabus for ID. And again, there's a lot more detail there. And I wanted to highlight where you can find that. So if you look at the curricula for micro or virology, you'll find the syllabus in the appendix. And for infectious diseases, if you look on the website, the syllabus is actually a separate document to the curriculum, but it's worth opening that up and having a look and making sure you have a copy of that so that you have a bit more understanding about what is required, and hopefully that's helpful. So I just wanted to highlight those the detail to you. So do have a look at those curricula. Now, Professor Brian Angus is going to talk to us about examinations in detail, but it is part of progression through training, so I did want to mention it. So any trainee who's going to do who is microvirology or dual training, so in fact all of you in this meeting will do part 1 infection, and on the website that is this picture associated with it, and then you'll go on to do part 2 microbiology or virology. Trainees in ID and internal medicine do the CICE and no part 2. And in fact, the CICE is the same as the part 1 infection exam. They are the same exam, but they have a different name because you don't do a part 1 if you're not doing a part 2. That can be confusing, and it's also confusing because there's also an exam that the clinical scientists or microbiologists or virologists from overseas may want to sit, and that's under medical microbiology and virology on the website. So just make sure you're doing the part 1 infection. Any queries, please ask. And when to sit it, so the end of CIT or early into your higher training, don't try and sit it too early. There is information, there are questions that relate to laboratory side of training and also clinical ID. So you do want to have done a significant proportion of your CIT training. Some of you will have had a lot of experience before, and we leave that up to individuals and their educational supervisors, but that's just a general rule. If you're going to go on to do a part 2, you must pass part 1 by the end of ST6. So you have enough time to sit part 2. So from my perspective, what do you do? Please register with the college. So as monospecialty trainee in virology or microbiology, you will register with the RCPath. And then as a dual trainee, you register first with the JRC PTB, but also please register as a dual trainee with the RCPath. That means that you'll get all the information about relevant emails about relevant activities from the college, about the portal. It means that we are able to double check you're doing the right exam, that your TPDs are linked in as well, and the college needs to know that you're one of their trainees. So please do register with the RCPath, and if you're not sure after this webinar, please double check. Know what you're aiming for. So familiarize yourself with the curricula and the decision aids, record evidence through the year, but just make the most of all the different educational opportunities available, of which there are many. Talk to your ESs and your TPDs, fellow trainees. Networking always provides lots of information. I'm always surprised how much I learned from peers and other people, and along the same lines, do join specialist societies. Often they're free for trainees to join. So, and I haven't listed them all, and I almost didn't put a line in about them because I worried about missing some off. But I have listed some examples. So BIA, HIS, BSAC, BEVA, BASH. There's lots and lots of different specialist societies to join, and you hopefully will be able to then make use of their training days, etc. as well. We always need feedback, so please feedback to us about things that are going well, things that you'd like to see go differently, or issues that you have, because then we can improve or do more of the same if it's good feedback. In general, from my perspective, the main message is enjoy the journey. It's a really exciting time to be an infection trainee. As you will know, there have been huge changes over the last few years, and every month that goes by, there's something new and exciting to challenge you and to learn from. So enjoy the journey, and please, if you have questions, Anne and I will take questions together at the end. So thank you. And now I think, because I'm controlling the presentation, Anne,
You are.
I will take the lead from you now, and I'll try and anticipate.
See how we go. Yeah. So just to add my welcome to Harriet's and Ronan's. I'm an ID physician in Sheffield. And I did traditional IDGIM training, but I've learned a huge amount more about the more laboratory-based specialties since working as a consultant, and all the way through learning. And now I work very closely with Harriet. As she said, we co-chair the combined infection training, which basically means that year on year we alternate rather than doing a double act like we are today. What that means is that you will get really integrated training that Harriet has described. What I just want to talk through is what your options are if you're interested in doing something outside the standard training pathway. So next slide, please, Harriet. You may be aware of this already from your IMT training, but out of programme, there are many options. The classic one everybody knows about is out of programme for research, and I'll talk a little bit more about that further on. But there are other options for those of you who may be interested in doing something different, but for whom research is really not your bag. So just to be aware, so you can, for example, request an out of programme training slot. So people who've done something like this in the past have opted to spend 6 months at the Rare and Imported Pathogens Laboratory down at Porton Down near Salisbury. So you get loads of experience of parasitology and molecular tests for the sort of the rare and imported pathogens, so RIPPLE. So things like that, or you may opt to do some time in, for example, a different centre. Maybe you're interested in OPAT and your particular training centre doesn't have as much OPAT experience as you'd like, and you might discuss being able to do that. So there are lots of options in which you could do training somewhere else. All of it requires discussion, but this is the sort of thing that if you apply for it and it's granted, then contributes to your training time, doesn't extend your training time, and can be a really useful way of ensuring that you get the training that you want. Because while at the moment you're at the start of your training journey, the aim is that as you progress, you will work out what it is that really you find interesting. So, for example, one of my interests is HIV, so I do HIV clinic every week, but some of my colleagues don't do any HIV medicine other than looking, contributing to inpatient care. Harriet, you're the anaerobe lead, aren't you, as one of your many hats? So there's many things that you'll pick up as you go, and you'll just find what it is that sort of rings your bell. OOP-E is quite an interesting thing. So trainees that I've had taking time out for OOP-E have spent time with UKHSA doing public health work. They have spent time overseas. For example, there are some really interesting training bursaries from things like ECMID, so the European things. So we've had trainees who've gone and spent time working in a laboratory in Madrid in the last year. So that sort of thing can be considered OOP-E. It's not training because you're not being supervised by a UK trained consultant, but it's certainly valid and relevant and really quite interesting. There are two other OOP options that you may be interested in, because not everyone has a straightforward progression through training. And I think it's really important for us all to acknowledge that life happens while you're going through your clinical training. So you're not a machine, you're a doctor, you're a human being. And sometimes things can happen along the way to you or a family member that means actually you need to take a break from your career. So a career break is called an OOP-C. And this is literally you walk away from training and you may work in some other things. So this might be, for example, I know some people that have gone off to do the round the world yacht race, for example, or it may be that you've got specific child or family caring needs, and you need a bit of time off. So it's slightly different, and it's a very bespoke thing, but there may be specific things, and it allows you to literally stop everything for a year. It can, on rare occasions, be extended to 2 years, but it is one of those things, and it is something that your TPD would discuss with you if that is something, if that was something that needed to happen. And OOP pause is a relatively new thing that's been brought in, and this is where kind of you've got an OOP opportunity that doesn't really fit with anything else. And there are lots of reasons why people might opt to do this. In an OOP pause, you may continue to do some clinical work, but you literally hit pause, so it does not have to count towards your training time, although you may retrospectively choose for it to do so. So, for example, you might want to do a little bit of time in research, or you might want to reduce your hours, or there may be something else going on that's just so overwhelming that you just want to be able to come in, do your 9-to-5 work and go home. So there are lots of reasons around that, but it exists. It is very much a valid option, so do be aware of that. Then this bottom one is a new initiative that's been rolled out in the last couple of years called flexible or portfolio training. And this is not for everybody. So there is an option whereby what they want to do is, the initiative, it came through the College of Physicians, and it was trying to encourage people to stay in hard to fill specialties, your A&E, obs-gynae, stuff like that. And it was recognised that actually was a really useful option. So there are some exceptional trainees who want just to have time to do a project, a particular thing or a particular thing that interests them, and it would just really benefit from a day a week being able to concentrate on that particular thing. So it is something that trainees can apply for. The issue about flexible portfolio training is that you might have a day a week on your project, but it does not hit the pause button on your training time. That can be a good thing. Won't feel like it where you're sounding, but trust me, further down the line, it does feel like a good thing. But you are expected to hit all your competencies, to gain all your competencies in that 80% time that you're left, and you're expected to continue your normal on-call commitments, because the trust is paying you for 5 days a week, even if you're only working at 4. It does work pro rata if you're already less than full time. So that is just to be aware. For OOP, R, T and E, So any of those, you will still have an annual review of your training. So it is recognising, so there will be a requirement for there to be a report from your supervisor for any of those things. Some stuff going into your e-portfolio. You still have an ARCP to check that you are hitting your target, so you don't get to go and have a jolly for a year without actually committing and recognising that it's appropriate to your training. Next slide, please, Harriet. So the key thing for you to be aware of, this is something that you're interested in, you need to talk to your TPD. They will be the ones signing the forms. You don't talk to them, they won't sign it. Ain't going to happen. But also it has to be approved prospectively from the deanery. And I'm going to use the word deanery because they change the name so often, but that's your regional supervisor of training. So ideally 12 weeks in advance. Okay. And that is really important. There's a lot of paperwork. As TPDs, we're trying to organise training for everybody in the region. And so actually letting you disappear at short notice can make our life very complicated. And the easier you make our life, the easier we can make yours, in all honesty. So do send the forms in plenty of time. There has been a lot of discussion recently about how you can make sure that competencies that you learn when you're out of programme, not in OOP-T because that already counts, but in OOP-E and OOP-R, you might be doing a load of, you might be doing OOP-R where you're seeing patients every week and actually you're gaining a lot of competencies. You come back at the end of your PhD, 3 years have gone by and suddenly you realise you've still got another 3 years in your programme and you're like, come on, I've grown, I've developed, I've got so much more experience. So we can retrospectively approve those capabilities when you're reviewed at your next ARCP. But it is expected that you have sent in a form detailing what your options are before you go OOP. And it's a little bit complicated, but just your TPD should be able to advise you on that. So do collect evidence as you go. Don't shelve your e-portfolio. It is your record of competence and record of evidence. And the more that's in it, the more it is easy for us to sign you off. Please don't make your TPDs and ESs chase you, because an empty e-portfolio with tumbleweed blowing through it is really off-putting. However competent you are, you do need to prove that you're competent to people who don't know you. Next slide, please, Harriet. So yeah, just to mention research. So there are lots of options for doing research, and you may not even have contemplated research as part of your training from where you're standing at the moment, but we're a relatively academic specialty. There are often research opportunities. Talk to the people that you're training with, talk to other trainees around, see what's around. So some academics will have a pot of local funding and they will be quite keen if you're interested to facilitate you doing that. So the fund, I've had trainees who have stepped into a 6-month research post that has then transmuted itself and and they've actually had 2 or 3 years out of training and done an MD or a standalone PhD, sometimes by publication. So there are lots of options. So don't feel that you have to enter always with an academic through the academic training programme. There are, of course, and some of you will have done this, academic programmes. So the ACFs, Academic Clinical Fellow, and their equivalents with different nomenclature in the devolved nations. These are usually ST3 or ST4 entries. If you are an ACF, it means that within the first 3 years of your clinical training, you're expected to carve out 9 months of academic time, which is protected, during which you should be developing a proposal for a PhD or an MD. And then, if you're successful in getting your PhD, MD approved, then you would take OOP-R for that time, and then you would return back into the clinical training. Personally, I love having ACFs. They're always excellent trainees, and there is a huge benefit. You become supernumerary, so the academic programs pays your base salary, so I just have to pay your on-course salary. So as far as I'm concerned, it's a win-win all round. At the end of your 3 years of ACF time, you then slot back into a clinical training slot. But we are used to moving people around in our deanery, and I think everybody does that. Next slide, please, Harriet. If you're successful in gaining a doctorate, whether it's MD or PhD, then your next option may be to consider applying for an academic clinical lecturer. The academics within your department, or regionally or nationally, will be advertising these. Usually they're tailored when they're aware of people who have got research that marries in with their local interest. Usually, so this is people who've already got a PhD under their belt. They will usually have 18 to 24 months left in training. If you're successful at applying, then you get 50% of your time is clinical, 50% of your time is academic. So effectively, you double your remaining clinical time, but you have that protected time to continue to develop your academic interest alongside your clinical training. Next slide, please. Oh yeah, who makes the decision? So one of the things that I was thinking about this was, I think as trainees, you can feel quite disempowered. You don't really know who's got the oversight into your training. And so I kind of put this slide together to try and explain it. So your educational supervisor should be the person that you liaise with most of the time. So they have the day-to-day oversight of your training, and if you've got issues or problems, then you should talk to your ES in the first instance. The TPD is always there, and we are across all the specialties. We're a small specialty if you compare us to some of the biggies like the physicianly specialties or surgery or O&G. So most of you will have a direct relationship with your TPD. So your ES, you can talk to your ES, you can talk to your TPD. As TPDs, we answer to the head of school within our region. Above the head of school is the associate dean. Above them is the regional dean. And the regional dean sits on a national committee, which is COPMed, so Committee of Postgraduate Med Ed Deans. And this is the sort of reason to make you aware of this hierarchy is that we're all under supervision, if you like. So I can't make a unilateral decision about my program, but I can recommend it, and I would talk to my head of school. She would then escalate it up to the associate dean, or directly to the dean of the region, and he will sign it off. So it's very variable, but that does allow us to be quite responsive in our region. We know our regional needs and our training needs. We know our trainees, and if there's issues going on, then we do that. We're always across the nation pushing to get more infection trainees, and I think the pandemic has just really highlighted how valuable we are as a specialty, and we are always in need. Infection trainees do really well at going into consultant jobs. There are very few bottlenecks once you've got your CCT and infection training. But as TPDs, we come together. So as Harriet mentioned earlier on, there are regional specialty training committees. So again, sorting out and disseminating information and gaining feedback from training in region, and we're always trying to improve it. When you fill in your GMC training survey, that comes back to us, and so we get red lights and green lights about how the quality of our training, and that impacts on us. All the TPDs come together and we sit on the specialty advisory committees, which we've already talked about. So Harriet chairs the Microbiology one, I chair the IDTM one, we co-chair the combined infection one. And as SACs, and so for us as chairs, we answer to the RCPath and the RCP, or JRCPTB, because it is the Joint Royal College of Physicians Training Board. RCPath has responsibility for the exam, and RCP has the responsibility for the e-portfolio. Again, this is some of the complexities of infection training, but our aim is, and the reason for this joint training is, we are producing modern infection doctors. So you will, across your time, encounter people who've trained in old school way, who will sort of shake their hands and mutter about the other specialties. But actually, you guys are the doctors of the future and the infection doctors of the future. And there will be new developments, new technology, new travel, new diseases that you will be dealing with that were not even heard of when Harriet and I were in training. And so this joint working is proving extremely fruitful. And ultimately, RCPath and RCP and all the training is overseen by the General Medical Council and signed off. So changes to curricula have to be signed off by the GMC. So there is a hierarchy of control. There is oversight. But there is also your input. So we do at the SAC, STC, we do listen to trainees. There are trainee representatives on both the STCs and the SACs. They will be sending you out surveys. Please answer them. So because even though you're a brand new trainee, your input will be very valuable, and we want to make sure that we are providing the training that you need to do the job for which you're being trained. And I think that is my last slide, Harriet. Is that right? Yeah. So we're really happy to take any questions. You can stick them in the chat if you've got them. I think we're waiting for Brian to join for your next talk anyway, Ronan, aren't we?
Yeah, that's right, Anne. So thanks very much, Harriet and Anne, for an excellent and really comprehensive talk. And so, yeah, I would say to everyone, it's not often you get a chance to ask anything you like, well, almost anything you like, to the chairs of your training committee. So please do take the chance and type a question in the chat. Maybe I'll just ask while we're waiting for the trainees to think of a question. Maybe I'll just ask, do either of you have any kind of tips or tricks for the new trainees as they approach the kind of daunting task of looking at all of this material in the curriculum and the syllabus, as they think about all of the workplace-based assessments that lie ahead? Do you have any kind of advice or pointers that you'd give them about where to start or how to plan any of what they have to do?
I'd say talk to your colleagues. They are already jumping through those hoops. They will know best. They will have done the hard work already. They'll have gone through a round of ARCP. So people who are 2 or 3 years ahead of you, they will know. And what I would particularly say, if you are new to the NHS, so I think the guys who have gone through IMT training in the UK, it will feel very familiar. You will know what a mini CEX is. You will know what a case-based discussion is. You will know how to have those conversations with your consultant supervisors and how to make sure that you're ticking off those things. But if you are new to the NHS, then I think it is really important that you find a colleague, ideally somebody who has done this before. And across the NHS, we are hugely supported by people who have trained outside the UK, done their original training outside the UK. So you will not be alone. There are resources within the college for international medical graduates as well, and there should be resource in every deanery for an IMG as well. But I would talk to somebody who has done that before. If you have trained outside the UK, it can be really intimidating asking a consultant for support, but we are used to it. And pick your time. If somebody's in the middle of a busy ward round or in the middle of an MDT, don't ask them then. But actually, if you have spent a lot of time working on a particular patient or a particular case or a particular scenario, then you've already done a lot of the work with that particular consultant lead. So it is really very minimal to ask them afterwards and say, could I send you a ticket for a case-based discussion on that? And my other top tip is, if you send a ticket, put as much detail as you can in the scenario. Do not expect the consultant to fill that in, because you know what needs to go into your e-portfolio, and what your key learning points are. So you put that in the clinical scenario, and we will fill in the rest. Make it easy for your trainer, and they will find it easy to support you.
Yeah, very much second that. But also, and your trainers will be used to this as well, so they're used to doing it. So really, don't worry about asking. And I suppose the only other thing I would say is don't be overwhelmed. So actually, the requirements in the decision aid are very achievable. So it's not. It's different to some specialties where you've got a logbook and you've got to get loads and loads of procedures and things. It's actually very achievable from your day-to-day work. If you've been on call for a weekend, you will have worked closely with the consultant and make use of that, get something out of it afterwards. Don't be overwhelmed. Just take a bit of time to get used to what's required, but also just do it steadily, step by step, because then by the end of the year, you will find you have fulfilled all the things you need to do. Have your meetings with your ES. If you're not able to schedule that, then raise that as an issue with the TPD. If there's some issue there, then raise that. But yeah, own your e-portfolio because it is yours. But don't be overwhelmed. As Anne says, talk to your colleagues because they're doing it now, and you'll be absolutely fine.
I think a really good rule of thumb, if you can put 1 or 2 things in your e-portfolio every month, which doesn't sound too much, but actually at the end of the year, you will absolutely have managed to hit everything. You know, use the reflections to document the learning that you've done through when you've attended training days, regional training days, local training days, national training days, that sort of thing. Use the reflections button for learning which doesn't fit in any other box, but you're still learning, you know, a challenging consultation that you've had, difficult families, difficult, you know, interactions with other healthcare professionals, that sort of stuff. If you're worried about putting anything in your e-portfolio because of confidentiality or because it's particularly challenging, then talk to your ES or TPD about how you would document it, because there's ways of writing things that documents your learning without compromising you. And I know a lot of people worry about that after the Howagaba case. But you know, we are there to support you, and you will find all the TPDs are absolutely, you know, our job is to fight for your training over the demands of the clinical service need. Alongside that, you know, don't forget that you learn by doing the job. You know, so training is not separate from clinical service, but we want to make sure that the balance is right.
That's fantastic. Thanks very much, both of you, for those tips. That was really useful. So own your portfolio and put a little bit in often, bit like a savings account or a piggy bank.
Yeah.
So I can see we have a couple of questions here.
Great.
2 of them probably slightly more tilted toward Anne about tropical medicine. So
okay.
I
can't see them, unfortunately.
So if you click Q&A at the bottom, it'll come
got
up.
you. Yeah, got you.
So the first one is, how does the process of applying for tropical medicine work? Where, when do we hear about this?
Yeah. So there are very few tropical medicine training numbers. They come up about 1 a year. So they will be advertised, I think, in the BMJ. If it's something you're particularly interested in, then you might want to contact. So Sylvia DeFrey is the TPD in Liverpool, and Phil Gothard is the TPD in London for ID. They will be the key people. If you know, what's his name? There is the lead who is on the training committee. It's based at the London School and in Ripple. I completely forgot name, but either Phil Gothard or Sylvia DeFrey, or just talk to your TPD. They will be able to put you in contact with them if that is something that you are particularly interested in.
Okay, super, thank you. And there's another one there for you, Anne, while you're on a roll.
Yeah.
Someone who thinks it's a rogue question, but don't worry, it's not a rogue question. The question is it possible to apply for sort of retrospective tropical medicine in addition to this one CCT? For example, if you've done out-of-programme research with more than a year's clinical in a low and middle income country and previous DTM&H.
So your DTM&H counts, yes, definitely. If it is UPR, that is not the same. So it is, you would be a particularly unique case. If you have done that sort of stuff, then I would recommend that you chat to either Sylvian or Phil. You do have to have an NTN to get a TM training number. I think there is one coming out in the next year. Your previous experience can count. So if you say you've done more than 12 months clinical in an LMIC, and it has to be a designated place where your supervising clinician is recognised by the SAC. So they would be the people to advise you. So if you're not in either London or Liverpool, please get in touch with your TPD and ask them to put you in touch with either of those 2 guys or me, and I will forward that in accordingly. So with a bit more detail about what it is, but we wouldn't retrospectively apply. What I would say is that the vast majority of ID physicians working in ID units around the country and working within tropical medicine do not have a TropMed CCT. That absolutely does not preclude you from having an interest in tropical medicine and working within that. So the guy that set up our travel clinic here in Sheffield does not have a CCT. So but your experience doesn't vanish because you don't have a TM CCT. So they're great opportunities if you can get them, but I would not say that is something that you have to have, if that makes sense. So, your experience is very, very relevant to training within ID. The TM is just a cherry on the cake, but it sounds like you've pretty much ticked all the boxes anyway. So don't underestimate that.
That's a really important point, isn't it? That, your practice as a consultant depends much more on your capabilities than what it necessarily says in the kind of CCT. But with that in mind, if someone wants to have a CCT in tropical medicine, they will have to apply for a training number in this
absolutely.
pathway. And I suppose along the way, consider whether they've done anything that that would count towards that. But it does sound quite complicated.
I really don't think it is. So it's been streamlined. It used to be really, really quite murky in how people got them, and they've made it much more. They've actually clarified it quite a lot. So you have to be an NTN, existing NTN, and then you apply when the numbers are advertised. So, but so if you already have a DTM&H, then that's actually quite helpful. So then the two extra things is you would have 1 year of clinical training in the UK in either London or Liverpool, and then that 12 months. So, but like I say, it's the tropical centres are really fond of the TM training thing, but personally, I think it is a lot of people working within ID actually have, I have pretty much done all of those things. I just didn't work in London and Liverpool. I don't have a TM. I don't think that precludes me from looking after people with tropical infections.
Great, thanks very much indeed, Anne. Okay, we have another question here about, I'm going to skip over the one about question banks and for the exam and maybe save that for our next speaker who's going to talk about exams. So there's one from one of our participants about whether there's a timeline for when we would find out about the next rotation in February. So someone who'd like to be able to start planning ahead wonders when they'll hear about their next rotation. I suspect that varies by deanery, but would either of you want to pick up a comment on that?
Yeah, I mean, I think it will depend on the deanery, but it's quite possibly been planned already. So I would talk to your TPD because usually we are planning ahead. There are always, because we are a small specialty, and because people change their working patterns or do different out of program activities or other things come up, there are always last minute changes. But I would just talk to your TPD. From my side, I had to submit to HUAW the whole year's rotation weeks or months ago, but that's not to say it won't necessarily change because of all of those things that I've just said. And I don't know if your perspective is different in a different region.
Yeah, our deanery, we're expected to submit bare minimum 12 weeks in advance. But to be honest, I'm talking to my trainees all the time. So I think it is liaise with your TPD. If you've got particular needs, the sooner you tell them what you think you need, the better. So yeah, I would just talk to those. Ronan, shall I quickly pick up the DTM&H questions? Is that okay?
Please do. You've really sparked some interest in DTM&H.
Just so you know, by the way, I can't actually see the question, so please let me know.
Q&A button.
Yeah, it's disconnected some reason for mine.
Dear.
So
yes.
So
there are 3 questions about DTM&H. Yes. So DTM&H, there are if you choose to do DTM&H and you choose to step out of training to do the full-time DTM&H in either London or Liverpool, that is 3 months that would be counted as OOP E. So it wouldn't necessarily count towards your time in training, although it is, of course, very relevant if you're an ID trainee. It is not mandatory. but it is interesting, and it could be a really interesting thing to do. The amount of funding you would get would depend on what the local decisions about training are. You have a relatively small budget for all of your training through your training, so it's something you might want to think about, and you might want to think about the cost of it, given that you won't be getting your salary for 3 months. There are 3 other providers of DTM training within the UK who do a out of hours, if you like, training. So that is Sheffield, Glasgow, and Médecins Sans Frontières. And so you can do training through them. They do an exam that is supervised by the Worshipful Society of Apothecaries, that is still the DTM&H. So I can speak about the Sheffield one, but I know Glasgow also do an online one. So there's some face-to-face teaching at weekends, and then it is weekly webinars going through all the lecture series. And that may be, if you're unable to step out of training for financial or any other reasons, that can be a really good way of actually getting through the learning and getting to the point of sitting the exam. So those are the options.
And they're on our supported courses list, aren't they?
They are. They absolutely are. And they are considerably cheaper as a course than the whole-time equivalents as well. So those are the options. Yeah, I think that's it. But yes, previous trainees have definitely taken OOP time for it.
Okay. And I see you've added a comment there, Anne, just pretending to be an attendee, where you said that you've done the Sheffield part-time distance learning DTM&H and highly recommended it. So yeah.
Oh, that wasn't me.
Oh, it totally was. Tell the truth.
Totally wasn't me.
Only joking, but it's nice to have that feedback.
Yeah,
thank you.
Yeah, that's great. Okay, I do need to go. So anyway.
Brilliant. Thank you both very much. That's been a fantastic session. I'm sure everyone's found that really useful. Thank you.
Very welcome.
Thank you.
Bye-bye.
Okay, so we have a few minutes before the next speaker, Professor Brian Angus, is going to come along and talk to you about the Part 1 FRCPath in Infection and Combined Infection Certificate exam. So I suggest we have a very short break for just 2 or 3 minutes to give Brian a chance to join and get his slides loaded. So please come back to us in 2 or 3 minutes. Thank you.
Hello.
Hi, Brian. We're just having a very short break for a couple of minutes before your talk to give you a chance to join and get set up. So we'll maybe start in a minute or so.
No problem. Can you
Brilliant.
see my slides?
I can see your slides, so they're not in full screen mode, but you probably know that.
Yeah. How about now?
Perfect.
So when do you want to start?
Actually, I think we can go ahead and start now because I just suggested that we had a 2 or 3 minute break, and that was 2 or 3 minutes ago. So I think we can go ahead. So for the last talk of this morning, we have Professor Brian Angus, who is the lead for the Part 1 infection and combined infection certificate exams, and he's going to give you an overview of the exam that you'll take at the end of your CIT program. So thanks very much, Brian. I'll hand over to you.
Thanks, Ronan. Hi there. Yeah, sorry, a little bit late, everyone. So just going to give you a very quick introduction to the CICE exam. And thanks to Harriet, I don't know if you showed this already, but there's been a little bit of confusion about which exam to sit. So there are 2 different Part 1 RCPath exams, and you have to make sure that you apply for the correct exam. Did you cover this already, Ronan, Harriet?
So Harriet, yeah, has touched on this, Brian. She hasn't shown that table, but yeah, she's touched on it.
So I'll make these slides available for people as well, just to have a little look at. But it is important to make sure it is slightly confusing. So of course, there's the Part 1 CICE, which is the Combined Infection Certificate Examination, and that's 2 papers for all medical specialty trainees in single or dual training programmes. And the exam's the same for all trainees, if they're ID or if they're micro intending or virology intending onto RCPath Part 2. So the Part 1 infection exam is for medical microbiology, virology, ID, training programmes. As I say, it stands alone and is titled CICE if it's only for the ID trainees. So the nomenclature is admittedly a little bit confusing. Within that, there's a sort of subset for people who are doing MMV clinical science. And this is exam taken by medical microbiologists who might go on to take Part 2 or who are training within the UK. So as I say, just make sure that it's the correct one. So from the website, really, we're talking about the RCPath Part 1 and Combined Infection Certificate exam. And that started in 2016 and happens twice yearly in spring and in autumn. And really, it's to test the combined infection training in microbiology, virology, and clinical infectious diseases. And people are expected to have be in a specialist training programme for not less than 12 months. And the exam should be passed by the end of higher infection training year 2. But we usually recommend that you try and do it a little bit earlier in case, heaven forbid, that you have to do it twice. So the purpose really is to act as an assessment of knowledge and understanding across the combined scientific and clinical basis of medical microbiology, virology, infectious diseases. And it should reflect current clinical and laboratory experience and practice. So really it is worth getting some experience of laboratory microbiology and also some clinical infectious diseases as well, as the questions go across a wide range of topics. The papers themselves are 2 papers, 100 single best answer questions designed to test knowledge and understanding. It's online through TestReach. The questions are given randomly, presented randomly to the candidates. So no 2 people will be doing the same exam in the same order. The college doesn't host exam centres for the Part 1 exam. People can sit at home or they can do it in another environment. But the platform, TestReach, are fully live proctored via webcam and microphone. So the proctors are very picky about anything that looks suspicious and report back again. So the curriculum is the core knowledge, as I said, in microbiology, virology, and infectious diseases. And the combined infection training curriculum is common to each individual infection-related specialty training. And those are available on the website. So we have a blueprint. So we have a sort of way that we try and make sure there's a balance of things. And this has been decided by the various exam boards. And so within the sort of 200 questions, we want 20 of them at least on basic biology of bacteria. So these are things that are basic science, really, on bacteria, viruses, fungi, and parasites, and the host pathogen relationship. So some of the basic stuff, some of which you might have learned, first of all, in undergraduate, but it's quite important, we think, that knowledge continues. And then laboratory practice. So again, having spent some time in the laboratory will be useful. And that includes things like health and safety, not just in the laboratory, but also in the clinical infectious disease environment. And then 10 questions on public health, particularly things like isolation or infection control. So 10 particularly directed to prevention, infection prevention and control. And then 65, so the bulk of the exam really relates to important clinical syndromes. So again, across your experience working in infection in general. And then some 30 questions on the use of antimicrobial agents. And that includes mechanism of action of some of the antimicrobial agents, and also obviously practical things like drug interactions and those sorts of things, and resistance mechanisms. We have some questions, about 10, on vaccination. And again, worth reading the guidelines on different vaccination, particularly the Green Book. And then some 10 questions on HIV infection, and BIVA guidelines, particularly important for those. And then we have 10 questions on travel and geographical health. So particularly a focus on travel medicine. So 2 3-hour papers, they're marked by computer. There's a cross-speciality examiner panel. So we have a question writing groups across different specialities. They're all represented. And then we have an exam setting board. And then we have a standard setting group as well. And again, all the specialties are represented within that. So the pass mark is set by the standard setting group, who independently set what they think is the pass mark. And that's using a modified and-off process. The results in the operation are reviewed by the examiners, and we look and make sure that the exam is performing as we expect. So just a quick example of a question. So 20-year-old woman presents 2-day history of fever, headache, confusion, examination, temperature 39 degrees, Glasgow Coma score 11, no neck stiffness or rash, investigation, CT scan normal, CSF, protein raised, glucose, lower end of normal, white cell count 126, mainly lymphocytes. And then what is the likeliest positive organism? A, cytomegalovirus, B, enterovirus, C, herpes simplex virus type 1, D, human herpes virus 8, E, varicella zoster. So pretty straightforward, a little bit like MRCP question format to keep it nice and clear for everyone. Some of the questions, obviously, particularly basic science, don't have so much of clinical STEM, although often they are put in some sort of clinical context. But as I say, really the most important way of revising for these questions, for these papers, is to do lots and lots of questions. And so these are some of the resources we'd recommend. So British Infectious Society has some nice web pages. Green Book, as I said, for vaccination. And really, we make sure that our guidance is really nice, recommended guidance. Also recommend the Oxford Handbook, of course, Microbiology, and MIMS Medical Microbiology. And that's just a quick run through. Thank you very much.
Great, thanks very much indeed, Brian. That was a really nice summary of the exam, or at least the first exam that the trainees will do. There was a question from earlier that I said we'd save till you joined. So if you don't mind, I might put that to you now while we're waiting for any other trainees to ask questions.
Sure.
And the question is, are there any question banks available that we can utilize when preparing for the exams?
No, we don't provide. So on the website, we provide some example questions, but we don't have a large bank of questions that we can provide, obviously. We're constantly updating our bank of questions, and so we review things and make sure things are up to date, but we wouldn't be able to provide a large question bank for people to practice. I would say, as I say, the questions really are quite like a lot of the MRCP Part 1 questions on infection. So there are a lot of questions available for that that exam, but we don't provide any bank from here.
Great. Thanks very much indeed, Brian. And the same applies to the Part 2 FRCPath exams. There aren't any official question banks, but there are sample questions on the college website, which are there mainly not for practice, but to give you an idea of what the style of question is and roughly what the standard of question is expected to be. I don't see any more questions coming through about exams, so it looks like you might be off the hook for any further questions, Brian.
Thank you very much.
Super, thanks very much indeed. So that brings our webinar to an end this morning. I would just like to remind you all that Jenny has put in the chat the link to Slido for giving your feedback. So please take just a few moments at the end to give your feedback on today's webinar. And just before we wrap up, I'd like to thank the panel for coming along to share their pearls of wisdom with you. I hope that at this point you feel a little bit more orientated to your training pathway, to the assessments and the exam that you'll have to do in due course. And thank all of you, the trainees, for joining us today. I guess if I could leave you with one message, it would be that you're all very welcome to training in a pathology specialty, and I hope that you feel part of the college. And please remember, the college isn't some lofty or distant entity. The college is comprised of people, and we are those people. It's a community of fellows, trainees, and staff members. So as the president, Dr. Bernie Croal, said at the start, it's our college. It's all of our college. So please do get involved. And so with that, I'll wind up and thank you all very much again for attending. And I look forward to meeting some of you as the years go by. All the best.